Mayo is a good option for people that need treatment for their hip because Mayo has subspecialist care that spans the entire patient experience, from young patients that have common hip disorders to adolescents, to adults, to the most subspecialty hip disorders that might be one in millions, yet becomes something that's concentrated at Mayo Clinic and we see on an everyday basis. We're heavily involved in research at Mayo Clinic, including in hip preservation and hip treatment. And I think that's important to a patient because as a patient, the most important thing you likely want to know is, am I a candidate for this? Is this a good option for me? We're all scientists, we're all researchers. And if you want to be taken care of by someone, you want to be taken care of by someone that has written the literature on something, that knows the outcomes, that knows the background of why they're doing something. By doing research, I can back up what we're doing now, and we can be at the forefront and cutting edge of figuring out what we're going to do tomorrow to make patient care even better. We're able to counsel patients on the available data, on the available biologics out there. And really our expertise is highlighted by the fact that we have some of the only reviews that are published out there on the biologics in the hip, because again, this is one of our passions and something we're interested in. Our group, we're really proud of the fact we've done over 3,000 hip arthroscopies, and we've been following our patients. So when a patient comes in and wants to talk about a hip preservation procedure, be that arthroscopy or something else, it's really powerful to be able to pull up on the computer a research study by me, by my group, and say that this is the published data that actually comes from the institution that's going to treat you. And I'm happy to, together with the patient, go through the calculator and give them their percent chance. Whether it's a 10% chance or in our calculator, an 88% chance that they have a cartilage defect that needs to be treated. And we don't stop following patients at 1 year, at 2 year. We're invested in patients for life. And because of that, we know how they do at 5 years, how they do at 10 years. The hip and other joints as well are complex 3D structures, and it's hugely important to be able to plan for what you're going to do. I tell patients that to fail to prepare is to prepare to fail. We really want to know what we're going to do, how we're going to do it, and how we're going to make it just perfect. We're looking at 3D modeling. We oftentimes print patient models in terms of how can we best address their dysplasia, and that's something that is really, really hard to find elsewhere. And that has been hugely helpful in counseling, in providing great patient care, and in order to be able to educate not just other providers, but patients as well, because a well-informed patient is a happy patient and knows what they're getting into.